applications of sensor networks in healthcare. And here's the table of contents or the outline for my presentation. To begin with, I'll give you an overview of sensor networks. Then I'll describe some health areas in which we can apply this new technology. And I'll also outline some current research and development. Then I'll explain some open problems or issues that need to be solved in the future in this area. And time permitting, I'll quickly run through the project methodology and some of my reflections on both the course as well as the project. But to begin with, let's try to understand what sensor networks are. A little bit of a background. In the past 4 decades, we have seen our processor costs plummet. Our devices are getting smaller and smaller because of advances in electronics. And in the last 5 years, the growth of wireless networks has really taken off. So these 3 factors have combined in the development of smart sensors. A smart sensor is an existing physical, biological, or chemical sensor which has been equipped with computational capabilities and wireless communication. So as you can see from the diagram, there's 3 main components to a smart sensor. The sensing unit, which collects the data, the processing unit, which performs low-level real-time signal processing, and the communication unit, which transfers the processed data to an external source. So a sensor network, then, is just a collection of these smart sensors which cooperate in sensing a particular phenomena. As you can see, a single network can have multiple sensor nodes or multiple smart sensors. They sense data for the end user or the observer. Now, the architecture also has a sink or a proxy node which acts as a bridge or a gateway between the observer and the sensor network. Now, all communication within the sensor network is wireless using transmission media such as radio or infrared. There is no central infrastructure within the sensor network. So each node has to act as both a data originator and a data router. The sink node, however, does have access to an existing network infrastructure such as internet, and hence it can act as a bridge between the observer and the sensor network. Now, the flow of data can be bidirectional, so the sensor network can send information continuously to the observer, or the observer can query the sensor network for specific piece of information. So what are some of the characteristics which distinguish sensor networks from other computer networks? The most important one is dense deployment of nodes. A single network can have from anywhere between 1,000 to 1,000,000 of nodes. Now, this is primarily because of electrical engineering constraints, but now we are left with a massively distributed system. So now, since there are so many of these nodes in a network, we want to keep the cost of an individual node low. As a result, each node has limited amount of resources. So it has limited battery life, limited processor capabilities, and limited storage, as you can see from the sample system described. Also, because of dense deployment, global identification can be difficult. So instead of talking to a particular node X, which is just one of 1,000,000 possible nodes in the network, you really want support for attribute-based addressing, wherein you talk to all nodes which have a certain attribute. For example, their current temperature is greater than 37 degrees. The topology of the network can also change because of mobility or failure of nodes. With those characteristics at the back of our mind, protocols and applications for sensor network need to satisfy certain design factors. The main one is energy awareness and resource efficiency. Now, we also need to consider other factors such as the scalability, the security, the fault tolerance, and the adaptive behavior of the protocol or the application. And the reason for these design factors will become clear as we explore applications of sensor networks in health. So let's move on and see which health areas we can use this new technology. I'm going to talk about 3 main health application areas. And my primary focus is going to be on personal health monitoring and diagnostics, where sensor networks are used to monitor for vital signs and health indicators. But we can also use sensor networks for disability assistance to compensate for certain handicaps, or we can use sensor networks in biosurveillance for population well-being monitoring. So let's move on and examine each of these three areas in detail, starting with personal health monitors. A natural question is, why would you want to have sensor systems for personal health monitoring? As an alarm security salesman would tell you, because they give you security of frequent monitoring in the comfort of your homes. For some people, especially the elderly and the chronically ill, knowing that various health indicators are being monitored on a continuous basis is a tremendous source of peace of mind. So you can have devices which are implanted or worn externally to monitor your health metrics such as blood glucose, your blood pressure, your body temperature, and heart rate. And we can do all this monitoring right in your homes. So this can reduce the number of hospitalization or nursing home visits, and the tremendous, and the potential for cost savings with home-based monitoring sensor systems is tremendous, given that we have an aging population. So don't be too surprised if you start seeing advertisements for personal guardian angels on TV. Sensor networks also allow us to ensure that our patient health record databases are up to date. The idea here is to have the sensor system automatically update the database. So by removing the humans out of the data entry loop, we ensure that our records are always kept up to date. And similar systems have been deployed for other applications. So this particular application of sensor networks in healthcare is bound to succeed as well. Finally, we can use sensor networks for early intervention. We can have thresholds set up to warn about impending medical emergencies. For example, if your blood glucose exceeds 180, your physician could be alerted. We can also use sensor networks deployed in your body to monitor the effectiveness of a new medication or a drug on a continuous basis and see how your body is reacting to that drug. In fact, we can use the data from such sensors to release optimal amount of dosage. So here's an illustration of a typical sensor system. In fact, this person has multiple sensor networks attached to him for monitoring metrics such as EEG, ECG, and movement. But all these sensor systems form a wireless body area network with a single personal server. Now, the personal server acts as a gateway between all these sensor systems and the external world. And it uses the internet to update the data gathered from these sensors to the patient's health record database. Now, to give you an idea of some of the existing research and development in this field, I'm going to describe two commercial systems. Now, my final report contains a lot more examples, but let's look at this representative diabetes management system from Sontra. The objective of this system is to allow for continuous non-invasive glucose monitoring. So the system consists of sensors which are put under your skin, and these sensors monitor your blood glucose. These readings are then transmitted to an external wireless meter. So this system allows for continuous monitoring of blood glucose even for patients who don't have motivation to do it on their own. In fact, the company is looking into automatically injecting insulin based on your current blood glucose level, and this would really be building on work done by Albeiser and others back in the 80s who showed that a closed-loop control system for regulating blood glucose in humans can be really effective. The second and really cool system is the Capsule endoscopy system from Given Imaging. The objective of this system is to enable direct visualization of the small intestine. So this is useful for diagnosing gastrointestinal problems. The system consists of a capsule that is ingested. As the capsule passes through your body and the gastrointestinal tract, it streams wireless images to a receiver which is worn on the belt. Now, it's important to note that the data being collected is not just a single valued parameter such as temperature, but sophisticated image data. And throughout this process, patients can continue their daily activities. There's no need to sedate them. There's no need to blow up their stomach as with conventional endoscopy systems. And this system has been approved for sale both in Canada and the US. Now, some researchers have proposed using sensor networks for early detection of cancer and also for monitoring the status of transplanted organs. But let's move on and look into the other health application area for sensor networks, which is disability assistance. Now, sensor networks are an important component of the artificial retina project. The objective of this project is to enable sight in visually impaired people. So as you can see, the system consists of multiple components. The most important one is the sensor array, which is placed on your retina. And this sensor array generates electrical signals which mimic the normal behavior of retina in response to light stimulus. So we need communication with the sensor array for feedback control and also for image identification and validation. So there have been other proposed prosthetic applications of sensor networks, including using them in artificial limbs and brain or spinal implants. This might sound as if it's the most futuristic applications of sensor networks. However, I'm willing to bet that we'll have a commercial prosthetic application of sensor networks before the Leafs win their next Stanley Cup. Famous last words caught on tape. Let's move on to this final health application area, which is population well-being monitoring. This is a conventional application of sensor networks. The idea is to have sensors deployed at various locations in the environment, especially crowded urban areas such as movie theaters or subway stations. And these sensors will monitor the air continuously for presence of contagious diseases or, more importantly, biological or chemical agents. So the idea is to have early warning of bioterrorism attacks. In fact, we can use data collected from such sensors to generate a health map for the population. So here's a diagram which is used typically to motivate the presence or motivate why you would want to have sensor networks for biosurveillance. You can get warning of a bioterrorism attack at least 4 days before conclusive symptoms show up, or 6 days before the attack starts turning fatal. So it is really critical to have sensor networks as an important component of your bioterrorism strategy. Let's shift gears and move into the next half of my presentation, which is some of the open problems in this area. Now, after reading through much of the literature in sensor networks, I got the feeling that most of the problems in conventional sensor networks, which operate in an external environment, have been well documented. So there's been surveys which list these problems. But there's no such listing of problems for in vivo sensor networks, meaning sensor networks which apply or which operate inside or near the human body. And since the working environment is so different, we would expect the problems with such sensor systems to be different as well. So one of the objectives of my project was to fill this niche and have a clear listing of problems for in vivo sensor networks. And I also proposed some initial line of attack for some of these problems. So the first problem is energy awareness. This has been studied to death for conventional sensor network applications. But our problems for in vivo sensors are really different. For example, we want to control the amount of heat generated. If you have a sensor system on the top of your roof and it generates excessive heat, it's not end of the world. But if a sensor system inside the body generates excessive heat, it can damage the surrounding tissue, or the rising temperature can be conducive for bacterial growth. A simple solution for keeping the amount of heat generated low would be to use lower frequencies for communication. We are also looking for new renewable power sources. Existing ones, such as solar cells, would not really work well inside the body. Battery life hasn't kept up with advances in computing. So we need to harness energy to power these sensor networks from other sources, such as use the motion from walking, as a system which debuted last year did. An engineering problem is creating good sensors. Not only do the sensors have to be size and shape compatible, but they also need to be compatible with the body so as to allow or so as to prevent unintended interactions. A CS problem is accurate acquisition of data and diagnostics. Different people have different normal levels, so the sensor system really needs to adapt to the environment in which it is operating. But here we can borrow much of the lessons learned with existing clinical decision support systems. We're still looking for an appropriate transmission medium. Radio has two main problems, interference with other devices, such as your garage door openers or telephones, and radio waves are prone to signal jamming or eavesdropping, which can be a security hole. Infrared works well only for line-of-sight communication, so it's not suited for sending data out of the body. Now, a research project which had a lot of hype some years ago proposed using the human body as the transmission medium, but I haven't seen a commercial application of this as yet. And we also have to be worried about the loss in signal strength because of the presence of water in the body. Now, two problems which will really become evident as we deploy more and more sensors is managing the mass or excessive volume of data that will be generated by these sensor systems. We really need intelligent storage and data management techniques, and also need to adapt our existing data mining algorithms so that they scale well with large volumes of data. We also need interoperability between sensor network systems. It's not too difficult to envision having multiple sensor systems from different vendors. You have a blood monitoring system from Sonra. You have a temperature monitoring system from Vivago. And these systems need to use the same proxy to communicate with the outside world. For that, you need common data and API standards. And existing ones really have to be made resource aware and bandwidth friendly. So there's lots of work that needs to be done there. We also need common platforms on top of which we can build sensor network applications. But let's cut to the chase and come to what I consider to be the biggest problem for sensor networks in health, which is security and privacy. Now, disclosure of individually identifiable medical records is a felony offense. You can be put behind bars for allowing unauthorized people to access sensitive data which is being generated by sensors. So we really need to create jamming-resistant transmission media. We need to adapt our cryptographic techniques so that they work well with limited resources. Alternatively, we can introduce anonymity in our data transfers. Now, that's for data protection, but we also need to secure our system from denial of service attacks from hackers. We also need to take into account the social implications of implanted sensor networks. Here's a question for you. How do you convince a person that a system which has been expressly created for monitoring him on a continuous basis is not just another big brother contraption? We as computer scientists cannot ignore the cultural, psychological, and legal issues which stem from implanted sensor networks if we really want them to be used on a wide scale in health. So to conclude, sensor networks really have the potential to revolutionize healthcare, but there's lots of open problems that need to be solved. So I hope by the end of my presentation today, you have a good understanding of some of the applications of sensor networks in health, and you're also aware of some of the research challenges which we need to solve. A very quick run through my project methodology. These are my information sources, mostly papers published in the last 4 years. Health-related publications were obtained from the National Library of Medicine website. Here's a pictorial description of the milestones in my project. Starting as an inquisitive graduate student with some interest in health informatics, I want to end up as a happy graduate student who solved at least one problem in in health informatics. Some insights. Sensor networks is really one of the hottest area in distributed systems right now. No matter which research group in CS you belong to, I'm sure you can find at least one problem in sensor networks that you can work on which is related to your research interest. There's lots of opportunity for publication, lots of funding sources as well, always good for PhD students. And there's really excellent prospects for growth of sensor networks in healthcare because we can provide better quality of care, and there's also potential for cost savings. As for sensor networks in health, for this to work well, we need cooperation between healthcare specialists, computer scientists, and engineers. So here's my shameless sales pitch for today. We have in distributed systems, we have a research group called What's More. We are looking into problems in ubiquitous system and mobile computing. So I think there's lots of opportunities for joint work between we here and What's More to work on problems in communications and computing infrastructure in health. Finally, as for the course, I really enjoyed it. I found it to be extremely instructive. I have 2 suggestions for future offerings, which essentially translate into more work for the next batch of students. But the first one is to increase the frequency of presentations by students. We could have a presentation at the beginning of the term wherein students outline their CS research interests, and this can be followed by a group discussion to help that student in finding health areas in which he can work. We can also have a presentation towards the end of the course in which students review papers which are being read by somebody else in the class. So this not only broadens our horizons, but I think it would be an excellent way of keeping people on their toes and ensuring that the project quality improves, just because you know somebody is going to come and also examine the work that you've read or you're supposed to have read. After attending the research seminars from the Institute, I would urge Professor Kavi to integrate them with the course. I think it's an excellent way of keeping current with the developments in health informatics from domain experts. As for my references, there's some on sensor networks, their applications in health, related computing technologies. Here's a list of research groups which are really exploring applications of sensor networks in health. I couldn't find a single Canadian university which currently has a project in this. So I believe there is some opportunity for an NSERC grant here, perhaps. And some commercial systems. So thank you all for your time today, and I'll be more than happy to take any questions.
Well, I'll buy one, that's for sure. Okay, question.
I'm wondering about ethical considerations with respect to having sensors, and your reference to a health map. I'm wondering if that causes any ethical problems, concerns for you, that not that it would necessarily reveal someone's health record, but that it might identify people who have an illness. And people find out that this person is ill in some way, they have a cold or something, and we have people checking up on that, which is an invasion of their privacy. I mean, we do have laws, we require people like, let's say, tuberculosis, which is highly infectious, we require those people to go into the hospital. We don't require people to really take care of their own health if they don't want to. And I'm just wondering if you have any concerns that we have these sensors acting sort of like keeping toms over us.
So the question was, are there any ethical issues in having sensors collect data about potential illnesses in people and producing a map, so as to speak, of various illnesses which people might have? Absolutely. There's lots of social and ethical concerns there. But leave the map application aside. It's as simple as a person sitting outside your house could be just scanning radio waves for various data being transmitted by your sensor systems. So you can get access to your heart rate, you can get access to your blood glucose level, which your system is merely broadcasting as radio waves. And this person can actually sell that data to possibly insurance companies. So there's lots of ethical questions as well, but more importantly, there's security and privacy issues which need to be resolved from a technical perspective. So the ethical concerns, I think the question would probably be more valid to a sociologist or somebody from the arts department. But for a computer scientist, we need to really maintain the privacy. And a simple thing to do might be just to introduce anonymity in all the data being transmitted, so as to mask the identity of the person whom the data belongs to. If all you want to do is really construct a map of the population, so that you don't really want to trace the illness down to a person. So it depends on what application. For personal monitoring, you really need to trace the illness down to a person, because the person has paid money to buy it. But for public health monitoring as such, I think anonymity might be a good solution to work around the ethical questions.
Now, you've indicated that in terms of in vivo sensor networks, are there any in use right now? In other words, multiple sensors, and what are they used for?
Most systems that I found really had a single sensor, so they did not so they did not really have a network so as to speak of. The prosthetic applications, especially like the artificial retina and putting sensors at various locations in the artificial limbs, they really do require a network of sensors. But there hasn't been a physical manifestation. It's mostly just research ideas so far. And the commercial applications which have been deployed are mostly single node solutions or single sensor nodes. But some of the problems do remain the same, whether you have a single node in the network or you have multiple nodes. But the concern there is that we are moving towards a multiple node scenario with prosthetic applications where we need to worry about interoperability and things like that. And in fact, if you consider two different systems, let's say you want to use the endoscopy system and the blood glucose monitoring system at the same time, you can consider the two nodes, in fact, as a network just because they share the same proxy.
If not, thank you very much.
Right.